My name is Greg Bashan. I'm a cardiac electrophysiologist. I practice at TriStar Centennial Medical Center as well as TriStar Summit Medical Center. Electrophysiology is the treatment of heart disorders that relate to rhythm. So they can be slow heart rates or rhythms or fast heart rates or rhythms. And there are really a lot of different treatments, from medications to procedures to devices, you name it. Electrophysiology works very closely with the other subspecialties within cardiology. Typically, we co-manage patients with them. And so while a patient may have one doctor that deals with their heart attack and their stent, if they end up needing a defibrillator or something called an ablation, that's when the two of us start working together and I get involved. While the team and I treat virtually all heart rhythm problems, I would say the majority of the problems that we treat are due to a rhythm called atrial fibrillation or due to slow heart rates, which are typically treated with a device called a pacemaker. Sometimes we also treat patients who have a weakened heart muscle and may be at risk for fast rhythms, and they get a pacemaker/defibrillator. I think when a patient comes to see one of the electrophysiologists here, they can expect, first of all, that we will have had a thorough understanding of what their problem is in terms of communicating with their provider, but then I want them to leave with a thorough understanding of what the problem is and what the treatment options are. And once they've chosen that treatment option, I want them to come in with understandable expectations of what they're going to have. Recovery and follow-up can vary depending on what the procedure is, but take for example, a pacemaker implantation. Typically, they spend one night in the hospital, go home the next day. They do take it easy in terms of lifting with that arm for a few weeks, but down the road, I tell them that they can expect to have about once a year to come in and get checked in the office. And now the majority of the visits can be done remotely at home, where the device can be checked by our clinic and our specialists without them having to come in. If I was to talk to a patient about what's happening here at Summit and what they're building, I would want them to understand that it is a comprehensive program where we have specialists, everything from general cardiology to interventional cardiology to electrophysiology, and when needed, even advanced heart failure and structural heart as well. And that all of the specialists work very closely together, sometimes two or three of them involved with the same patient. One of the things that I like about practicing at Summit with my colleagues out here is that the vast majority of the procedures and the clinic visits can be done here, but we still have seamless access to any of the advanced therapies that can only be done at a tertiary care hospital like TriStar Centennial. So it's very easy if it's an inpatient to transfer them. It's very easy to see a patient here in clinic and schedule a procedure downtown if needed, but yet the majority of the patients and the procedures can stay here closer to home.